For being here today. Members of the State Assembly, State Senate, concerned citizens, and of course so many of our essential healthcare workers who are being unreasonably and unnecessarily fired for not complying with Governor Hochul's unilateral mandate. We're here today because the governor is imposing a mandate that requires healthcare workers to receive at least one dose of a COVID vaccine by today or forfeit their jobs unless they have a medical exemption. The mandate could lead to staffing shortages and chaos in our state's hospitals and nursing homes and abruptly force frontline healthcare workers out of their jobs. It doesn't have to be this way. With simple measures like enhanced PPE and testing requirements, we can keep hospital staff and patients safe without throwing the healthcare system into chaos, kicking people out of their jobs who have sacrificed so much to keep others safe throughout the pandemic's worst days. I made the personal choice to get vaccinated. I encourage everyone to consult with their doctor and come up with a decision that is best for them. Operation Warp Speed was a public-private partnership that led to the development of multiple COVID-19 vaccines in record time. I voted to fund vaccine development and eventual distribution starting in March 2020 as part of the Coronavirus Preparedness and Response Supplemental Appropriations Act. I voted for the 2020 appropriations bill that included funding for vaccine distribution. I introduced a bipartisan bill to eliminate cost barriers for COVID-19 vaccines for veterans. Here on Long Island, as the vaccines were becoming more widely available to the public, I successfully urged the state to establish state vaccination sites on the East End so that all Long Islanders who wanted these shots could have convenient access to them. Approximately 75% of Americans have received at least one dose of the vaccine to prevent serious illness, hospitalization, and death. I do remember earlier this year when elected officials, including the President of the United States, was stating that it should not be a requirement to get the vaccine. The President of the United States, Joe Biden, his position was that this should not be mandated. Our healthcare workers were nothing short of heroic the past 18 months. Regardless of the uncertainty, lack of PPE, and other essential resources at times, gruelingly long hours and pain, suffering death around them, they rose to the challenge over and over again and helped us navigate some of the pandemic's darkest days and saved lives. We shouldn't be firing these essential workers. We should be thanking them for all they've done for our communities. Governor Hochul is willing to throw our state's healthcare system into crisis-level staffing chaos. Crisis level are her words, not mine. Some hospitals throughout the state have already postponed elective procedures and maternity services. These healthcare workers helped us through some of the pandemic's worst days, and they're now going to be forced out of their job. And it is being reported that Governor Hochul has reached out to State Department about replacing them with foreign workers and possibly even calling in the National Guard to replace unvaccinated healthcare workers. I would point out that the medical workers in the National Guard are oftentimes currently part of the New York State healthcare system. So by calling in the healthcare workers of the National Guard, many of these people are already part of the New York State healthcare system, hospitals, nursing homes, and more. These people have families and mortgages, and they're at risk of losing everything by the stroke of a pen, from one governor who was on his way out in disgrace, and another who wasn't even elected to the position.
Yes.
According to the Department of Labor, they won't be able to apply for unemployment either. Governor Hochul's policy has been completely black and white with its coldness and no gray area. You're either vaccinated and can keep your job, or you're out on the street. Her order does not allow for a religious exemption, which was at least temporarily changed when a federal judge stepped in. Medical exemptions are difficult to obtain. Hochul's mandate also does not take into account people who have been infected with COVID in the past and could still have natural immunity antibodies. The science is still very new, and there is some uncertainty about whether natural antibodies or antibodies from the vaccine are stronger. This is still being studied. A study from Yale, BMJ, and Cold Spring Harbor Laboratory indicates that natural immunity could be at least as effective as vaccine immunity. An Israeli study found that people who recovered from prior SARS-CoV-2 infection and remained unvaccinated were 27 times less likely to experience symptomatic reinfection from the Delta variant when compared to those who had not been infected and received 2 doses of the Pfizer-BioNTech vaccine. Scientists are still researching the topics of antibodies and immunity, and until we know more, we shouldn't automatically assume that someone previously infected with COVID doesn't have protection against COVID. Scientists are still researching just how much vaccinated individuals can carry and transmit COVID even after becoming fully vaccinated. There are also people concerned that while rare, there have been serious side effects and injuries during the vaccination process, as well as nearly 8,000 cases reported to the federal government as alleged deaths due to the vaccine. The bottom line is this: people who are not vaccinated by the end of today should not automatically lose their jobs. There are ways such as enhanced PPE and frequent testing requirements that serve as a reasonable alternative to keep hospital staff and patients safe while also keeping our frontline healthcare workers employed. It's time for Governor Hochul to put aside this partisan agenda and come to a more measured and reasonable solution that does not ruthlessly take away the livelihoods of people who have sacrificed so much on behalf of our country, state, and communities. There are millions of people who live on Long Island. And there's so many millions of more in the New York City metropolitan area, in the city, and the Hudson Valley, and all across the entire state.
Keep fighting, New York City.
And when this pandemic first hit, with so much uncertainty,
We had no PPE
without access for many to PPE,
with tape.
many having to experience COVID themselves and bring it home to their families.
I did.
That's right.
Yep.
Me too.
Really?
They answered the call. And here we are now at the end of September of 2021.
Yes.
And this is a moment that all of us should be getting together and hugging and thanking and praising and paying tribute to, reflecting on that sacrifice, honoring these healthcare workers.
Yes.
This is